This video provides a practical guide for hospital leadership on implementing medication management standards. It focuses on turning complex accreditation requirements from organizations like JCI and CBAHI into safe, everyday clinical practice, while staying informed by the American College of Clinical Pharmacy's guidance on comprehensive medication management. Medication safety is a vital leadership priority. Errors often stem from weak systems rather than individual carelessness, making this a problem leadership can design out. Research shows that billions are lost annually to non-optimized medication use, but this cost and harm can be recovered by standardizing systems and embedding clinical pharmacy expertise. Medication management is an interconnected system, not just a single department. Every step, from selection and procurement to monitoring, requires its own controls to ensure safety. It functions as a closed loop, where monitoring and evaluation feed back into policy, driving continuous improvement throughout the entire organization. Hospitals often deal with multiple accreditation standards. Instead of running parallel projects, build one robust system that satisfies both JCI and CBAHI requirements. By performing a single gap analysis and mapping it to these frameworks, you prevent the duplication of policies and eliminate conflicting clinical practices. Foundations for safe medication management begin with governance and system design. Before writing specific rules, leadership must ensure there is a clear organizational structure, an evidence-based formulary, and a definitive map outlining exactly who is responsible for each part of the medication process. A multidisciplinary pharmacy and therapeutics committee is the engine of a successful program. This committee serves as an advisory body to leadership, overseeing policy, managing the formulary, driving medication evaluations, and acting on safety alerts to ensure the entire institution remains aligned with quality and safety standards. The formulary serves as the backbone of safe prescribing. It limits unnecessary variation and acts as the single source of truth within your electronic health record. By maintaining complete evidence-based monographs and embedding decision support, you can significantly reduce the risk of errors during the prescribing process. Resilience in medication management requires planning for exceptions, shortages, and disasters. Patients should never miss a necessary therapy due to stockouts. Establish clear, disciplined workflows for non-formulary requests, high-cost therapies, and surge capacity to ensure continuity of care regardless of supply chain disruptions. To ensure clear accountability, map every task in the medication use process to a specific role. A single matrix helps remove ambiguity, guides staff orientation, and provides a clear basis for competency sign-offs. This approach prevents common gaps at handoffs, where individuals might assume someone else is responsible. Authorization for medication tasks must be clearly defined by role, competency, and privilege. By creating a permission matrix, you make boundaries auditable and ensure that only authorized personnel perform specific, high-risk tasks. This practice is essential for maintaining compliance and supporting institutional credentialing processes. This section examines the medication use process step by step. We will look at what each standard requires at every stage and identify the practical controls you can implement on the ward and at the counter to deliver safe, consistent care. Procurement is a critical patient safety control. Integrity begins before the medication reaches the shelf, requiring reliable, licensed sourcing and validated cold chain maintenance. A tight custody trail, especially for controlled substances, is vital to prevent diversion and ensure quality throughout the supply chain. Medication storage must protect potency and safety everywhere in the facility. This requires strict adherence to manufacturer conditions, including temperature and humidity control. Regular inspections and a clear, documented process for managing variances, such as isolating affected stock, are necessary to prevent harm to patients. Emergency medications must be available, uniform, and secure. Standardizing the contents of crash carts across the facility ensures that responders find the same drugs in the same place every time. Implementing tamper-evident seals and routine verification checks prevents drift and ensures that vital supplies are ready when needed. Finally, a medication recall system must be fast and effective. You need the ability to quickly identify and locate affected units, even those already dispensed or administered. A reliable process involving quarantine, patient reconciliation, and clear documentation protects patients and ensures compliance with regulatory requirements. Securing narcotics and psychotropics is a core component of storage. This requires an unbreakable accountability trail through custodian oversight and consistent two-person counts at every shift change. Any discrepancies must be resolved immediately, escalated if necessary, and documented to maintain control over these high-risk substances. Prescribing safety is built on computerized order entry. By forcing orders to be complete and unambiguous, and performing real-time safety checks, you eliminate the risks associated with manual, illegible, or incomplete prescriptions. This is your most effective control for preventing prescribing errors before they reach the patient. Prescribing privileges must be clearly defined and electronically enforced. By matching a clinician's specific competencies to the medications they can order, you prevent inappropriate use of high-risk agents. These system-level hard blocks ensure that restrictions are not just policy on paper, but enforced reality in the EHR. Verbal and telephone orders are inherently error-prone and should be strictly minimized. When they are truly unavoidable, the process must include a mandatory readback for verification and a prompt co-signature. For high-risk medications, these orders should never be permitted at all. Medication reconciliation is the single highest yield step in error prevention. Whether at admission, transfer, or discharge, the process must be owned by the prescriber and verified by a pharmacist. An active, standardized review of the patient's medication list effectively closes the loop on potential handoff errors. Before a drug is prepared or dispensed, a pharmacist must review its appropriateness for the patient. This essential check evaluates the order against allergies, interactions, and therapeutic indications. It serves as a vital second layer of defense, ensuring that only appropriate, safe therapy moves forward. Safe preparation and compounding are specialized processes. Sterile and hazardous drugs must be handled under controlled environments to meet international standards. Centralizing these tasks within the pharmacy, using standardized concentrations, and enforcing strict competency requirements are key to minimizing patient risk. Dispensing efficiency and accuracy rely on standardization. By using unit dose, ready-to-administer forms, and barcode technology, you simplify the workflow and reduce the opportunities for error. Coupled with complete, clear labeling and patient identifier checks, this ensures that the right medication always reaches the right patient. Administration is the final safety gate. A disciplined adherence to the rights of medication administration, verifying the patient, drug, dose, route, time, and documentation, is crucial. This systematic, verified approach is the last opportunity to catch any discrepancies before the medication is given. Technology acts as a powerful enabler for bedside safety. Barcode-assisted administration turns the rights of medication into a real-time electronic verification process. Tracking this compliance provides leadership with valuable data to identify and resolve systemic barriers, rather than focusing on individual blame. In some cases, patients may safely manage their own medications during a hospital stay. However, this must be governed by clear eligibility criteria, formal education, and secure storage. Constant reconciliation and documentation of these doses are necessary to ensure they remain safe and integrated into the overall plan. Monitoring patient response is as important as the administration itself. This step is about identifying the impact of the drug, both intended and adverse. By establishing first-dose vigilance, allergy checks, and trigger-based detection systems, you actively search for and prevent harm instead of waiting for error reports. For high-risk medications with narrow therapeutic indices, expert monitoring is required. Pharmacist-led dosing and specialized clinics ensure that drugs like vancomycin or anticoagulants are precisely managed. These services are key safety interventions that require defined protocols and direct documentation in the patient record. A medication use evaluation, or MUE, is your engine for continuous improvement. By annually reviewing how medications are actually used, including antimicrobials, high-cost, and high-risk drugs, you can compare practice against evidence-based standards. Every evaluation must drive a concrete action for systemic change. In summary, defending the high-risk points of the medication system is a critical leadership responsibility. A small set of drugs and situations accounts for the vast majority of preventable harm. By focusing your strongest safeguards where they matter most, you ensure the highest level of patient safety. High-alert medications require a dedicated program, not just general care. Maintain a facility-specific list, including drugs like insulin and opioids, and review it annually. Control is achieved by limiting floor stock, reducing available concentrations, and requiring independent double checks during both prescribing and administration. Concentrated electrolytes are a major hazard and should be removed from general floor stock entirely. If they must be kept for critical needs, they should be stored securely with clear warnings. Pharmacy-led standardization of ready-to-use diluted concentrations is the most effective way to eliminate the risk of fatal dosing errors. Look-alike and sound-alike medications are a common cause of wrong drug errors. You need layers of defense. Use tall man lettering, physically separate these products, require indication-based prescribing, and utilize barcode scanning at the bedside. Maintain a local list driven by your own near-miss data. Certain medication classes, specifically anticoagulants, insulin, and opioids, recur in every dataset of serious harm. Each requires a standard policy with clear, auditable controls. From dedicated devices for insulin to lab monitoring for anticoagulants, these safeguards should be institutionalized as non-negotiable safety requirements. Treat antimicrobial stewardship as a governed safety program. It should be co-led by a physician and pharmacist, with restricted agents requiring pre-authorization. Success is measured by tracking de-escalation, adherence to stop dates, and monitoring resistance trends, which should be regularly reported to executive leadership. Hazardous drugs, such as chemotherapy, require strict containment to protect both patients and staff. Follow recognized standards like USP 800 for compounding and disposal. Ensure only privileged, trained staff handle these agents and use dual verification for every regimen to confirm accuracy before release. Safety and improvement form the core of this section. Errors are essentially information. When they occur, the goal must be to make reporting easy and blame-free. Your objective is to transform what you learn from these events into meaningful, lasting changes to your system. Establish a reporting culture where any staff member can easily report a near miss or hazard without fear. A just culture distinguishes between human error and reckless behavior, providing support rather than punishment for mistakes. Remember to always close the loop by communicating system changes back to the reporters. Voluntary reporting often captures only a fraction of actual harm. Use active surveillance, such as trigger tools that flag abnormal labs or the use of antidotes, to uncover hidden events. Consistently analyze these trends to fix underlying system weaknesses, rather than focusing on the individual case. When serious harm occurs, conduct a structured root cause analysis focused on system flaws. Define what constitutes a serious event in your policy, ensure mandatory reporting, and most importantly, follow through on your redesigned processes to verify that the same failure cannot happen again. This final section is about making your plans a reality. We will outline a phased roadmap to help you sequence your work, providing clarity on what to prioritize, how to measure your progress, and the common traps you must avoid to keep your program on track. A successful implementation requires a phased approach. Start by assessing your gaps and establishing governance. Build your core policies and storage controls next. Only then move into operationalizing technology like barcode verification. And finally, focus on sustaining your improvements through regular audits and a mature learning culture. To measure safety, avoid vanity metrics. Focus on leading indicators like scan rates or reconciliation compliance. Lagging indicators like actual adverse drug events remain important, but they are the end result. A rising near-miss to error ratio is actually a positive sign, indicating that your reporting system is working. Beware of common pitfalls, such as policies that exist only on paper, or alerts that trigger fatigue without providing value. Use this readiness checklist as a board-level tool. If you cannot tick a box, that area should become your immediate organizational priority for the next improvement cycle. In summary, medication safety is a system that must be designed by leadership. Standardize your processes before you automate. Concentrate your defense on high-risk drugs, and ensure reconciliation happens at every transition. Measure, learn, and prioritize a culture of safety above all else.